Blood pressure in particular has these effects on our major organs like our heart, brain, and kidneys.
It's something that we can impact and make a big impact on with just making a few changes. Blood pressure is something that most people don't think about. They don't feel it.
Making it hard for them to buy into taking a medicine every day and coming to see us so often. Our main reason for treating it is to avoid the complications like stroke.
I want to live for my kids, you know.
We can lessen the probability of dying from the disease. Education is key.
I'm Shaquana Divers. I am the program manager of the Blood Pressure Advocate Program. At the heart and soul of this program are 4 community health advocates working in 4 clinical settings. Each of the 3 local health systems, UR Medicine, Rochester General Health System, and Unity Health System, host a community health advocate in their clinical settings.
We're looking at people who have been identified as having high blood pressure, and so we assist them with lifestyle changes such as nutrition, physical fitness, stress management, smoking cessation.
These are things I wish I could do or wish I had time to do, but in the middle of the day during our busy schedule, we so often don't. So you're here today to follow up on your blood pressure?
Yes. I was up to almost 400 pounds. My doctor prescribed me to work with a blood pressure advocate.
So, how have you been doing?
We do a health assessment at the very beginning. Physical fitness, nutrition, if they're, capable of managing stress.
They can take preventive measures and control their blood pressure, just like they would quit smoking before they were to get lung cancer.
Mr. Smith, when I first started working with him, nutrition was a barrier for him.
I was eating terrible eating habits.
He said, I eat red meat pretty much 7 days a week. I asked him if he could eat red meat maybe 4 days a week. I suggested different vegetables for him.
Instead of cooking with so much meat and, more or less vegetables and stuff.
He would come in and say, oh, you told me about the eggplant. I cooked it the other night. It was wonderful.
I fell in love with it. I think I cook it almost every week now. But I added my own version to that too. Tomatoes, broccoli, I had some cauliflower, yellow and green squash. I just started adding more and more stuff, and it's very good.
At the very beginning, he wasn't very active.
Sonia taught me a lot of different exercises.
Exercises he could do in his chair
arms.
at home.
That helps with range of motion, all right?
Could hardly lift my legs up, but now I can do leg lifts, standing crunches. If I'm just sitting there watching television, I get up and I just start walking in place.
That's it.
Any kind of movement helps.
It's really helpful to have community health advocates in clinical settings because they are available to go the extra mile with the patient. They can spend that 30 to 60 minutes with a patient to help them overcome some of the things that go beyond the scope of medicine.
A lot of patients in our community have added stressors, financial, transportation, psychosocial issues that prevent them from going to another office.
There's a whole team here. Everyone really works together to help the patient. The patients really would not be successful without the team approach.
Sonia has access to our medical record and sends us her notes when she sees the patients and also what she's counseled them on.
How's your medication?
Good.
It's good.
It's very important to have someone in your life to help you put health back on the list when it's been removed because of all the stresses that you're facing.
I have emphysema too. My breathing is a lot better now since I'm losing the weight. I lost 20 pounds so far.
When he walks in, he's not as winded.
My health is doing real good so far, and I want to continue losing more weight.
That's perfect. 120 over 76.
Oh, good.
That's wonderful. He's made leaps and bounds in terms of his blood pressure and his weight and his COPD and his back pains.
If I can get down to around 250, I think I'll be happy.
It's all because of you, so you should be very proud of yourself.
I am.
Good.
It's motivating me.
Yeah.
Please consider supporting this program as we strive to make Rochester a healthier community.